My name's Oliver Seligman. I'm 49 years old and the author of Befriending Bipolar, A Patient's Perspective. And I was diagnosed with bipolar type 1 when I was 17, so that was back in 1993. I was probably someone who, looking back, I did have certain signs that I might have bipolar or mental problems when I was younger. I experienced quite a lot of anxiety and was very much often quite afraid of things. I was afraid of the dark, I was afraid of wolves coming to my room, but it was a bit more than just being afraid. It was something that was a bit of a problem for me. On the other side, I was very sort of charismatic and very enthusiastic and full of life, and I was often the centre of attention and telling adults jokes to make them laugh and a bit of a show off really. And that side of life was really fun. So I had this kind of charisma, this kind of X factor. But I also, I did have this anxiety, and I also had really bad nightmares. I used to just have lots and lots of really bad nightmares. And I was a huge sort of perfectionist. I put myself under a lot of pressure particularly to do well at school. And I think looking back now, because I've been meditating now for the last 22 years, and looking back now, my mind, which these days is pretty quiet, was very, very busy and very, very agitated and neurotic. I found it incredibly hard to relax. I always used to look at people and look at my friends, and they could, be playing hard at school and running around or whatever, and then boom, they just kind of hit the floor and they just relax. They'd sit in front of a TV and they'd just be completely relaxed. And I used to be very jealous of them because I couldn't do that. I never felt relaxed in myself. Then I came back to school and I suddenly realized, oh my goodness me, I've got like less than a week until my first exam. And that was when this mania, which in the book I call it a euphoric mania, that's my word for it, and this then became an agitated mania. And my whole mind changed. I ended up going into psychosis when I was on holiday with some friends. I'd managed to annoy all my friends. I'd stolen a friend of mine's car and hidden it, which I thought was hilarious, but obviously wasn't. And basically, on a train home from my holiday, I handed myself into the police in floods of tears, and that was when the manic psychosis became a depression. And then I ended up in a mental hospital in Edinburgh for a couple of months. It was very magical how I discovered metabolic therapy. I wanted to spend more time with my parents because they're getting older and my dad has got dementia. And I've been living in Norway for the last 18 years. And so I decided that I was going to go over there for a while and help them out. And I thought, well, I have to try and do something constructive as well. I can't just sort of, just sit around. That'd be really boring. And so I managed to get onto a master's degree studying psychology of mental health at Edinburgh University. I had no idea if I could do it. I knew my brain was not up to it when I applied. I knew there's no way I can do this, but I'm an optimist and I'm a believer in magic. And I thought, well, maybe it'll work out. I was at a Bipolar Edinburgh meeting. That's a charity in Edinburgh, very cool charity. And they said something about this ketogenic pilot study, that they were looking for people with bipolar. And I thought, yeah, why not? Get to go to a hospital, another bonus. And so I signed up for it. And not only did I get to go to hospital a few times, but I actually also got to have 2 MRI scans, both with movies in the MRI scanner, which is a bonus. And I met some lovely people and started to learn more about bipolar, actually, even though I'd had it for almost 30 years by then. And that was how I kind of fell into it. And it's been amazing. When I first started implementing ketogenic therapy, very quickly I noticed a change. And I noticed this kind of calmness descending over my mind and my body. It was like breathing a huge sigh of relief. It's like, oh, that's nice, And that was very, very cool experience. And that immediately gave me hope. There's something to this. For the first few weeks, I just had this sort of calmness and being grounded, and I struggled a lot with trying to measure out the diet. It was very strict because it was a research study, and I struggled with that because my brain wasn't working because of the lithium. But luckily my wife helped me, and I managed to sort it all out. But then after 3 or 4 weeks, I noticed that the side effects of lithium were getting worse. And so I spoke to my doctor and decided to lower it a bit. And that worked a treat. And that was really when I started to notice the cognitive changes and the clarity and the ability to use my brain when I hadn't really used it for 20 years. And that's something I would like to say to people who are watching this video, and that is that I think that we have to find our own way with these things. You know, there's a lot of help and support out there, and there's a lot of good advice, but I had to do my own dance. You know, I had to do it and then give it up and then come back to it and actually then appreciate it. And other people will do a different dance with it, but it's cool that we find our own way. Makes it more powerful. I do think that the potential for keto to put a high percentage of people with bipolar and other illnesses into remission is very high.